I've heard lots of different stories and feedback from fantastic young nurses and midwives and their employers, talking about the challenges and opportunities around the Nightingale Challenge. And now, really, for the next stage of the Nightingale Challenge, where we launch the next big initiative that we think will really help to galvanise young nurses and midwives all around the world. So I would like to introduce you to one of our fantastic Nursing Now board members, who is a global nursing leader, Maureen Bisognano, who is going to talk to us about her passion and innovation for early career nurse and midwifery leadership. And then we'll move on to hear from Munashe, who is one of our fantastic young nurses that's really give us the inspiration to create this global initiative. And we'll go on to Jenny from SameU, and then we'll have a wonderful close with our co-chairs, Lord Crisp and Professor Sheila Tlou. So I think without further ado, Maureen, it's over to you.
Thank you so much, Lisa. And I'm delighted to be here, and particularly to talk about this topic, because as you mentioned, I have so much passion for nurses being the best people to reinvent our healthcare system. I am going to hopefully share some slides with you. Let's see. And can you see that?
No, not yet.
Okay.
Did you click the blue button on the left, Maureen?
I did, yeah. I'm still pretty new to this, but let's see. Well, let me, oops, sorry. Let me talk you through what I was going to say. And what I wanted to do this afternoon is just tell you some stories about ways that at this point in time, we're seeing nurses change the world. And there are so many stories. I don't know them all, but I'm hoping that you will use this opportunity to share some of your stories with me. First of all, what's our challenge? The Nursing Innovation Challenge. We've got changing patient and provider experience expectations. So people come expecting to have a stronger voice in the healthcare system. We've got new research taking place at breathtaking speed. We've got technology and new equipment. I've got a dog in the background who's decided to make some noise. Then we've got expanded mission scope. It used to be early on that we were focused on providing clinical and technical care. But now, as we've heard all day today, so many people are working upstream and beginning to think about how do we prevent illness? How do we keep people healthy? How do we co-produce care? And now we've got COVID and equity problems. And there's so much opportunity for us to really jump in and start to think about what nursing can do to reinvent healthcare and nursing. The challenges are these, I think. One thing is getting the nurse's voice heard. So many times when I'm in healthcare organizations around the world, in every one of your continents and countries, what I hear is that nurses come up with new ideas, new innovations, but then they're reluctant to make their voice heard. And so what I'm asking for all of us to do today is not only to think about our role in innovating, but also to think about our role in spread and diffusion. So take pride when you make an improvement. Share it with others, because some of the nursing stories I'm going to tell you this morning are not only incredible innovations, but these nurses then had the courage to share those stories, and the spread and the impact has been global. First, I wanted to talk about Katrina from Denmark, who is now called the backpack nurse. She works in hematology and was working to try and help people not have to come into the hospital for advanced chemotherapy, but also be able to live full lives. And so she invented a backpack with the Copenhagen School of Design and some other clinicians, where all of the patients' intense chemotherapy administration materials could actually go home with them. And it's allowing these patients to live much fuller lives, to be home and to prevent infections, to be home and living, to doing what they want to do. And it was an amazing experience for me to talk to Katrine and also to talk to her about how the benefits to the patients are so important to them that now this idea is spreading from her hematology clinic to across her hospital to across the country and now spreading globally. Another great experience was Joost de Blok in the Netherlands. Some of you may know him, a home nurse who used to go into people's homes, and he was a passionate member of their families, their care teams, and knew everything about them, not only the clinical care that he needed to give, but all of the home and social determinants, circumstances that they were living with. When the government changed policy and made it difficult for nurses to go in and do all of these things because they were restricting what everybody could do by their license, he found that there was no joy in his work. So he left his employer and founded the Buurtzorg, which means neighborhood care, and brought other nurses in who wanted to take care of families, not just a clinical condition. Buurtzorg has dramatically improved clinical outcomes, saved money, and is now spreading around the world because he had the courage to say, I need to take care of more than the colostomy bag. I need to take care of this whole patient and his family. And for me to go out and do home visits with him was really to see the impact that that point of view can have. I met in Sweden a patient and a nurse who the nurse had taught the patient how to do his own hemodialysis. Now, I know patients can do their own hemodialysis and peritoneal dialysis, but this nurse and patient combination said, it's not just us teaching you how to do a particular procedure, but how do we create a sense of social connection? How do we work on your nutrition and your exercise as well as the clinical procedure that I'm working with you on? And so they changed the whole way that patients give themselves dialysis in Jönköping County. And then when I met them, I introduced them to a nephrologist in Texas. And that nephrologist now, I actually flew the nurse and the patient to Texas, and the patient and the nurse taught the nephrologist, this is what the procedure should be like. Better outcomes, lower cost. And now that nephrologist has left his practice and he's spreading across the United States to try and take the work of that nurse and patient from Sweden everywhere in the United States. There's a new app that the patients developed called My Dialysis, My Choice, where they go through an app and they say what matters to them. I have a dog, or I want to sleep at night, or I have a job, or I'm afraid of needles. And when they go through the app, it tells them this is the best way for you to do your own dialysis. And I love that we're seeing this idea of co-production really strengthening the vision of how we think about health. Also in Maryland, there's a wonderful nurse named Sarah Zanton who was out doing home visits, and she would go in with her bag and do her procedures, do her meds and her vital signs and all, but then look up at the person's surroundings and say, this isn't healthy. So she created an innovation that she called Capable. And it's a program to keep elderly people healthy in place, aging in place. So she built a multidisciplinary team with a nurse, an occupational therapist, and a handyman. And the three go out, and each one has a different impact on the health of that person and keeping them healthy in place. It was such an amazing experience to see the impact on health that the handyman had. But again, this is keeping people out of risky hospital situations and keeping them stable and nurtured in place. It's saving money, that's allowing people to go in and do other things. And just like the dialysis, just like the other examples I've given you, Capable is now spreading around the world. What I loved about this was that when they would leave a home visit, the nurse the occupational therapist and the handyman, they would get in the car and say, "What did you see?" And they all saw different things. And it really, I think, reinforces the need for us to create teams, multidisciplinary teams. Another amazing example is a midwife, who was so frustrated by rushing through her procedures each day in Boston. Her population was largely underserved people who were working from an isolated setting. And she created a new model of providing care together. It's called the centering pregnancy model. And what she found is that rather than putting someone in one room and rushing through a visit, getting 10 patients in the same room together who all had the same levels of concern allowed not only social connection, not only a broadened sense of experience, but incredible improvements in clinical outcomes. The cesarean section rate is down dramatically in the centering model. Breastfeeding rates at 6 months are the highest we found around here. And the centering pregnancy model is now spreading as well. Two final ones. One is a few years ago, I gave a challenge to the conference I was speaking at in France. And I said, when you go back to work, I had read an article by Susan Edgman-Levitan that said, don't ask the next patient only what's the matter. Ask also what matters to you. And nurses took me up on it much more quickly than any of the other people in the room. Jen Rogers went back to Scotland and asked patients on her pediatric unit. Anders Verge in Norway. Around the world, people started to find that when they also asked the patient what matters to you, it changed the whole clinical encounter. And that idea has spread from Jen Rogers and Anders Verge, the two nurses in the early setting. It's now, I want you all, your homework assignment is to go look at wmty.world, whatmatterstoyou.world. And every year since that speech, we've been celebrating What Matters to You Day. This year, 49 countries, thousands of organizations, 14.5 million tweets on that day. And people around the world are saying that those nurses stepping up and creating this is changing everything about their work. So WMTY, what matters to you, WMTY.world. And if you go look on the website, I'm inviting everybody to join us in this really rapid spread. And then the last example I wanted to give you is a group of public health nurses from a city in the United States where the population is very split. There's a small wealthy population and a huge poor population. And the young kids were dropping out of high school. Their health was terrible. They were doing drug abuse, many of them getting pregnant at early teenage years. And the public health nurses were desperate about this problem. They decided to go upstream, and these nurses started a high school. It's called the Rhode Island Nurses Middle College. It's a high school for kids 12 to 16, but they call it the middle college because they say this is just one step toward you going to college. They have had 873 students in this school. I'm telling you, I spent a day there and it was so amazing to me to see these kids with hope, to see them learning things like they were teaching me about how to take a blood pressure and how to walk with a walker safely. But these young kids, many of them, now the school's been in existence for 9 years. Many of these kids are going on to nursing school. Some have gone on to medical school. But it's an innovation where nurses thought upstream. I can't just take care of kids when they get sick. I need to think about what does health mean? And it is all the social determinants of health as well as the physical idea. So I'm working with them now to help spread this idea. But these are just some small examples of the things that nurses do when they see a problem and they step into it. it makes me think, as I close up my remarks here, that we need to think about nurses not only as clinicians and carers, but also innovators. And nurses can innovate because nurses see across the whole spectrum. They see every aspect of patients and families in a way that's almost unique within the healthcare profession. Nurses see more, they see the problems, and I think they really do step in and engage in some wonderful ways. So I want to encourage you to innovate. I want to encourage you to share those innovations broadly. We all here in this room today will help you to spread your ideas because the impact needs to be global. I want to encourage you to exnovate. Exnovation is when you get rid of all the stuff that doesn't add any value anymore. And we tend to not do that in nursing. We tend to put all the old forms or the old supplies in a closet, and we tend to keep adding complexity, not only to our patients' lives, but to our own careers. So I would love for you to think today as we wrap up this amazing day, how and what will you innovate? How will you share your story for spread? And how will you exnovate? That is, have the courage to get rid of all the stuff that really doesn't matter so much anymore. We've got so much to do, I think, but I'm so grateful to everybody. And I wanted to end with a quote from one of my favorite people here in the United States, Michelle Obama, our former First Lady. She and President Obama are my heroes. They've made such a difference in our country. And Michelle said one day, history has shown us that courage can be contagious and hope can take on a life of its own. And I feel like that's what we're seeing here today as we launch the Global Solutions Initiative. It's really an exciting time for us to think you have the power to care for patients, you need to take care of yourselves, but we also can fix healthcare in such a way that no other profession can. So first of all, thank you all for what you have done and what you will do. And I want to introduce Munashe so that he can give us an introduction to the Global Solutions Initiative. Munashe, over to you.
I'm not sure if Munashe is frozen. Thanks so much for that inspirational talk, Maureen. I knew we were in for a real treat there. Munashe, can you hear us? We can't hear you. Well, perhaps what we'll do is I'll make a start, and Munashe, when you can come in, then you can come and take back over. Does that sound okay, Munashe? Yeah. Well, it's with great thanks to Munashe actually, and many of his early career nurses and midwives that we've come up with this
Hello?
Global Solutions Initiative. Ah, brilliant. Munashe, we've got you. Over to you. Or maybe we haven't.
Hello? Hello?
Okay. Hi, Munashe. Can you hear us?
Hello?
I think probably Munashe is struggling. I'm wondering, Hannah or Catherine, whether we can get a note to Munashe.
Yeah.
We can hear you, Munashe. Can you hear? Can you go ahead and start talking?
I'm not sure he can hear us, Lisa.
Hello?
I'm just going to send him a message.
Munashe, and then he can come in.
Hello?
That's great. Ah.
Hello, can you hear me?
Yes, we can hear you. Yeah.
We can hear you, Munashe.
Oh, okay, sure, fantastic. Now I can hear you. Sorry. Thank you so much. And it's really exciting to be able to talk about the Nightingale Challenge Global Solutions Initiative, and to really have it as an initiative that is coming at this time. So the Nightingale Challenge Global Solutions Initiative is a platform to connect young nurses and midwives from across the world. So it is a platform for young nurses and by young nurses. It's a platform for us to be able to use in being able to share a space for young nurses to be able to tackle global health challenges and share solutions towards those global health challenges. So I'm really excited about the Nightingale Challenge Global Solutions Initiative, particularly at this time with COVID-19, because it gives us a platform as young nurses to be able to look at what are some of the challenges the world is facing today, and what are some of the solutions that we can come up with together to be able to tackle those challenges. So throughout the forthcoming months, what we shall be doing, we shall have a Facebook group that we encourage everyone to be able to sign up to. The name of the Facebook group is the Nightingale Challenge Global Solutions Initiative. And it is going to be on this platform that we're going to be able to share with each other and have webinars and have mentors talking to us on this platform and being able to share with us in being able to drive this initiative. So this platform is really for all of us as young nurses, and I really encourage all of us to connect. If you really want to be able to find out more, you can be able to get in touch with us and get in touch with Hannah from Nursing Now. And we really look forward to being able to have a lot of young nurses on board.
Fantastic. Thank you so much, Munashe. And I think it speaks, Maureen, to what you were saying about enabling nurses and midwives to be innovators, to be change agents, to be really confident that they can improve the care they deliver and create new and innovative pathways that deliver more and better care for everybody across the world. Some of the potential themes that we've identified from speaking to our early career nurses and midwives are issues that you can see here, things like personal protective equipment, mental health, telemedicine, intergenerational conversations, climate change, antibiotic resistance, and interprofessional collaboration. So we're so excited. And again, these themes have come from our young nurse and midwifery community. And I'm pretty sure there's a lot more out there that we're going to learn lots about. So I'd now like to hand over to Jenny from Same You, that's going to tell us about the fantastic collaboration that we're about to embark upon, Jenny, with this global initiative. Over to you.
Thank you, Lisa. Thank you, everybody. So very, very delighted. Same You is thrilled to be asked to create the first Nightingale Challenge Global Initiative, and we're very proud to be asked. So as you might have heard, we're very passionate about brain injury recovery and rehabilitation. And we really, from our own personal experience, feel how vital it is for nurses to become more involved in brain injury rehabilitation care. So what we thought would be interesting is to hand out the challenge to everybody around the world to think about nurse-led innovations in this specialist area. And I would encourage you all to look at recovery generally, but specifically about brain injury rehab. And so what we would love you to do is to think about these innovations and see how you can come up with the great ideas that you have, and then come up with recommendations of how you personally could see this being implemented in your area. So that's it.
Fantastic, Jenny. Thank you. And I think now for the finale, it's over to our co-chairs, Lord Crisp and Professor Sheila Tlou.
Okay, let me go first because I know my colleague has more energy than me. So I'll go before him. Yeah. Well, let me first thank all our guest speakers. I mean, from the morning up until this great session, because they've given so generously of their time to be with us and to really be at this, conference. Let's give them a virtual hand. Yes, yes. We have from the countries as well as the global implementing partners. We've been able to actually hear very inspiring stories and experiences and examples of implementing the Nightingale Challenge that really serve as best practices. And I'm hoping that this very particular one that we just launched will be really now the one that makes all our young people really participate together and form that social cohesion. So what impressed me most was really the way the new leaders and the mentees were able to describe how their plans and programs were able to adapt to the pressures of COVID-19. And it's really now to encourage those who've had to either, put their plans aside, or those whose plans change to say, it will be over. Not too over, but at least the brunt of it will be over. So let's resuscitate them and make them move on, because we are on until July 2021 and even beyond. So that this is not the end and all that. Now, hearing from the new leaders, especially in conversation with the mentors, was really very heartwarming. I called it the voice of the new leaders. They probably have been voiceless. And for some of them, it was actually their first time speaking with the top leaders in their own countries. So this created a very great platform, and I'm hoping we can see more of that being replicated at country level. The highlight for me in the whole day was really that innovation. Maureen talked about being innovative. There was a very innovative example of exposing young people to the United Nations, and a planned one, and I know it will materialize. Now, for me, it's really great because much as sometimes we talk of nurses and midwives, we forget that they are actually, relevant in all the sustainable development goals. One of my speeches at one of the ICN conferences was, all MDGs are health related. And I'm saying all sustainable development goals are health related, so that we want to also have nurses who are leaders in all of them, from the top 5, which are more people-centered, all the way to the others which are more development-centered. And indeed, the very best one to me, the one number 17, which talks about collaboration and partnerships. And that's what this, the Global Solutions Initiative is all about. So to me, this Nightingale Challenge Global Solutions Initiative is a big one for new people to galvanize the new nursing and midwifery leaders. So to them, the early career nurses and midwives, I say to you, this is your time. Make use of this. Become that formidable force that we will be able to reckon with, or that formidable source that can have a life of its own. So it's ready to say, we will be right there beside you, not behind you, but beside you. So I want to hear from all, the potential partners, therefore, who want to work with us to shape the future and to really ensure that no country is left behind. My message this morning, and the last thing I want to say, has been really to say we got a lot from the Nightingale Challenge, but we still expect a lot, because we know, much as we have almost 29,000, nurses and midwives enrolled, we actually still need more. We have more countries that have not participated, and we want to say we are one. Let's come back on. So with that, it's really to thank you very much and to say, let's go forth. The end is not yet near. Thank you.
Thank you very much indeed, Sheila. This has obviously been a terrific day, hasn't it? And the energy which I hear in this last session is absolutely contagious. I haven't been able to listen to the whole of the day. I've come in once or twice and listened to bits. But actually, let me just tell you a story. I'm in the British Parliament, and we have been holding our sessions virtually by Zoom, like other people. And one of the things I've been doing today is meeting with a group of parliamentarians to discuss what we're going to do about prescription drug dependence. So this is, you will all understand that. I can see people nodding, tranquilizers and so on. And you won't be surprised to know that more drugs are being prescribed during COVID, and that there's more anxiety around and so on. So we're seeing an increase in this, and this dependency is terrible. And we looked at a very interesting example that somebody presented to us, a really interesting example of the sort of service we should provide. And guess what? It was led by a nurse. It was a nurse-led prescription dependence dealing with service. I haven't quite got the language right. In North Wales, actually, as it happens. And it was a real model for the future. And it was very clearly led by this nurse. Yes, she brings in other people from time to time, other professions from time to time, but it was nurse-led. And it's just the sort of thing that the nursing now is all about, I think. And great to hear the challenge that
Nigel, could I just jump in with an example of that?
Yeah, go ahead, please.
That's such a wonderful conversation for us to be having now. But it reminded me that there's a group of nurses who were, because of COVID, were not working on their regular units in a hospital because the volumes were down. And so they asked that same question: what should we be prescribing for our patients? And they said, you know what, we should be prescribing compassion. So they created a compassion team. And those nurses who used to work in the operating room or in different units came together to create the compassion team. And they're out making connections with technology between people and their families who can't be together. And it just struck me as like the most great way for us to move from our old system of prescriptions, as you say, to a new nurse-led innovation, a compassion team. So thank you for letting me jump in on that, Nigel. Back to you.
Yeah, very, very topical stuff, because this is going to be a bigger problem for all of us. I gather that certain drugs in America, prescriptions have gone up 30% over this period, which it wouldn't be surprising, would it? But it was also fascinating jumping from a Zoom conversation in the House of Lords, where I have to tell you, I'm young, our average age is 70, to this conversation where, I'm old, and the average age of people around this whole webinar is probably quite a lot younger than me. So great, but what wonderful energy and what wonderful commitment I think we've been hearing all day. Now, as Sheila has said, our future plans are really important. We're going to run the Nightingale Challenge as it is up until the end of June, and Lisa, we're still welcoming people to come in, aren't we? And if employers have had to stop because of COVID, please start again, please keep going, please join in with this. There's plenty of time left to be running these programs. And we'd love to hear from you. I think people have already been saying we'd love to hear from you about your experiences and your ideas for the future. And if, of course, there are people out there who want to be part of helping organise that, in the sense of any of the big nursing groups or anyone who are interested in talking to us about how we carry forward the Nightingale Challenge, we'd love to hear that as well, because we haven't got a model yet at all. I'm just noticing that I'm being asked to encourage people to get involved with the Nightingale Challenge Global Solutions Initiative. So yes, let me reinforce that point, that we really do want people to join in and to pick up and to respond to Jenny's challenge with that and share experiences. One very technical point I need to say as well is that people will have missed some of today, like me, for various reasons, and partly just because I imagine we've got more people from North America at the moment than we have from India, although good to see people from India and Thailand are still there. But you can get recordings of the whole day. And I think you can get those from the Nursing Now website. You can look at them now, I think, on this screen, but you can also get them and listen to them later on the Nursing Now website. But let me finish as well with saying those thank yous, reinforcing the thank yous that Sheila talked about. I mean, firstly to the speakers, what a range of speakers from all over the country, and what a great start we had. Wasn't it terrific to have Tedros at the beginning, and to be reinforcing the great role that the great commitment he's got to nursing, even at this time of pandemic, that he steps out of managing a global crisis to talk to us, and he does that regularly, and that's absolutely fantastic. And he's a man under great pressure. And also to thank again our great ambassador for her passionate, and perhaps you could pass this on, Julie, Jenny, her passionate and obviously heartfelt commitment to nursing, which has been so great. And then people throughout the day who've been talking so well. Let me also say thank you to the team behind this. Always nerve-wracking trying to run something like this. I know there's been a few technical moments, but I think they've all been quite small technical moments. But congratulations to the whole Nursing Now team. I mean, Barbara and Lisa leading it, but Catherine and Hannah, who I know have been really working to make this happen and design it. And I see from the side here that Nick's obviously been involved in sorting some problems out, and Yvonne and Anthony and the whole team. Thank you for making this happen so successfully. And then thank you to the employers. I think, Sheila, you already said this, that really important that people have made this commitment and that they continue to make this commitment. And then finally to young nurses. Now, I'm not a nurse, but I do see that the future is nurse shaped, if I can put it like that. You know, the nurses are going to have a bigger, clearer, more important role in the future. That's what Nursing Now is about. It's about improving health globally by raising the profile and status of nursing. And I think probably if I were to choose one thing to say, it would be echo Maureen, actually, in something she said. You know, you get things done in this world by doing things. If I can put it that simply, not about talking, it's not about waiting to be told and so on. And it's that great remark you quoted from Michelle Obama of courage can be courageous, courage can be contagious. Really fascinating remark, isn't it? And nurses everywhere, you're working with your patients, you're working with the public, you have to take a lead, don't you? You have to make stuff happen. Sometimes you have to be quite brave and courageous. So great moment, I think, for you to be joining this profession, young nurses and midwives. Find yourself a mentor, mentor other people, be courageous, and let's see what you do. It'll be fascinating to watch and to see and to understand. And thank you, everybody, for this great day and for all the energy and commitment. And let's have another great year before the Nightingale Challenge moves on into its next incarnation. Thank you all very much.